Have you ever run your tongue along your teeth, where they meet the gums and felt a small notch? You might think it's just from brushing too hard, or simply that it's always been that way. But the real story is often far more serious than what you imagine. These notches have a specific medical name called abfraction, and they are an important warning sign that your body is sending you right now. In this video, we're going to analyze exactly what causes those notches, and more importantly, what will happen if you choose to ignore them for years to come. I once had a 58-year-old patient who came to see me with small notches like these. She thought they were nothing to worry about. But 2 years later, one of her teeth broke in half while she was eating a regular piece of bread. The cost to fix that damage was over $3,500, not to mention the pain she had to endure. The problem isn't just on the surface of your teeth, but it's also related to what's happening deep inside your body, from daily stress to unconscious habits you don't even realize. The answer may surprise you, and it could help you avoid a lot of pain and expense in the future. So please stay with me until the end of this video. If this is your first time on my channel, I'm Dr. Saul Whitman, Chief Medical Officer at Northern Institute for Society Wellness, with over 30 years treating thousands of patients with cardiovascular disease, atherosclerosis, stroke, and high blood pressure. My channel shares medical knowledge for older adults so you can live confidently as you age. And now, let's get into the video. Part 1. Brushing too hard is not the cause. Most people, when they see small notches near the gums, think that they've been brushing too hard over the years. That's a very natural and understandable thought because we've been taught since childhood that we must brush our teeth properly to protect them. However, in over 30 years, working with thousands of patients, I can tell you that brushing hard only plays a very small role in forming these notches. But the real cause is much deeper, and it's related to forces acting from inside your body rather than from the outside. Think about it this way. If brushing hard is the main cause, then why do these notches usually appear in specific locations like the premolars and not spread evenly across all the teeth you brush every day? The answer lies in how your teeth bear force when you chew and grind your teeth. And that's exactly what we're going to explore right now. Part 2. What is wearing down your teeth from the inside? Your teeth are not rigid stone blocks that cannot change. In fact, they have a bit of elasticity. Every time you bite or chew, tremendous forces are transmitted through your teeth, especially when that force doesn't go straight down the tooth axis but tilts to one side. When this happens, day after day, month after month, year after year, the neck of the tooth near the gum, where the enamel is thinnest and most vulnerable, starts to stretch like a rubber band that's been pulled too many times. This is exactly where the crystal structure of tooth enamel begins to break down from the inside. The image I often use to explain to patients is, imagine you bend a metal bar back and forth many times. Eventually it will break at the point that's been bent the most. Your teeth work the same way. It's just that this process happens much more slowly and you don't realize it until the notch has already appeared clearly. Part 3. Serious consequences if you ignore these notches. Now, let me be straight with you about what can happen if you don't address these notches early. The first thing most people notice is teeth starting to become sensitive to cold or hot things, and that sensation can be very uncomfortable when you're enjoying a morning cup of coffee or a glass of iced water in the summer. But that's just the beginning. When the notch continues deeper, it will pass through the protective enamel layer and go into the dentin inside, which is full of tiny tubules that connect directly to the nerves in your teeth. At this point, you don't just feel sensitivity anymore, but can actually start to feel real pain. This is when the real problems begin. The notch becomes a place where bacteria accumulate easily because toothbrushes cannot completely clean these wedge-shaped gaps, leading to tooth decay and infection. In the worst case, the tooth can break right at this weak point when you're eating something hard, and then you'll be facing tooth extraction or root canal treatment with costs of thousands of dollars. Part 4. The real causes of tooth notches. So what really causes these notches if it's not brushing hard? The number one cause I see in my clinic every day is bruxism, or in other words, teeth grinding and jaw clenching, especially during sleep when you have absolutely no control. According to data from the Global Sleep Research Collaborative, about 8 to 10% of the adult population grinds their teeth regularly during sleep, and this number gradually decreases with age, but about 3% of older adults over 60 still experience this problem. More worryingly, up to 23% of adults grind their teeth or clench their jaws while awake, usually when they're stressed or highly concentrated on work. You might be grinding your teeth right now without realizing it. Try checking if your jaw is tense or if your teeth are touching each other when you're not chewing anything. If so, that's a sign of awake bruxism. The second cause is uneven bite problems, which means your teeth don't fit together perfectly when you bite, causing some teeth to bear more force than others. Premolars are usually the main victims of this condition, and that's why research shows 77% of abfraction lesions occur in premolars. In addition, life stress also plays a very large role. When you worry about finances, health, or family, your body reacts by tensing muscles, including jaw muscles, and this leads to you grinding your teeth more without knowing. Part 5. Why just filling the tooth is not enough. Many people, when they come to the dentist with these notches, usually get them filled with composite, and they think the problem is completely solved. But here's what I want you to understand clearly. Tooth filling is only part of the solution, not the whole thing. If you don't address the root cause, which is the uneven biting forces or teeth grinding habit, then the notch will continue to develop right next to or around the filling. I've seen many cases of patients coming back after 6 months or a year with the same problem on the very tooth that was filled, and this time the notch is even bigger than before. This is like patching a hole in your wall without fixing the water leak problem inside the wall. The water will continue to damage other areas around it. Your teeth are still bearing the same forces as before, and the tooth structure is still being bent every time you chew or grind your teeth. That's why comprehensive treatment is extremely important, and we're going to talk about that right now. Part 6, recommended solutions. So what is the right solution? First, and most importantly, you need to address the teeth grinding problem if you have this condition. The most effective way I recommend to my patients is to wear a night guard. This is a plastic piece custom made according to your jaw. It helps distribute bite force more evenly and prevents upper and lower teeth from grinding against each other during sleep. It's like a protective cushion for your teeth. Second, if the problem is due to uneven bite, the dentist may need to adjust the tooth surface a bit so the teeth fit together better, or in some cases may need braces to realign the entire jaw. Third, stress management is an indispensable part of the treatment process. I often advise my patients to practice relaxation techniques like deep breathing, meditation, or yoga, because when your mind relaxes, your jaw muscles will also relax. And finally, after controlling the cause, filling the current notches with composite or other restorative materials is necessary to protect teeth from decay and reduce sensitivity. However, it's important to follow up regularly with your dentist to ensure no new notches form and old ones don't progress further. Part 7. What you should do next to protect your teeth. Let me give you a specific action plan that you can start today. First step. Self-examine your teeth by running your tongue along the area near the gums of all your teeth, especially the premolars on both sides. If you feel any notches or grooves, even if they're very small, schedule an appointment with your dentist within 1 to 2 weeks. Don't wait until your teeth start hurting or becoming sensitive, because by then, the problem is much more serious. Second step, pay attention to your habits during the day. Ask yourself, do you often clench your jaw when working, driving, or watching TV? If so, place a few reminders around your home or workplace with simple messages like relax your jaw to remind yourself to relax your jaw muscles. Third step, if you often wake up with jaw pain or headaches in the morning, or your partner says you grind your teeth during sleep, this is a clear sign of bruxism, and you need to talk to your dentist about making a night guard immediately. Fourth step, switch to using a soft bristled toothbrush and brush more gently, although this is not the main cause, but it will help reduce any additional damage to tooth enamel. And the final step, find ways to reduce stress in your daily life. This could be walking 20 minutes every day, spending time on hobbies, or simply getting enough sleep each night, 7 to 8 hours. When your body and mind are healthy, your teeth will also benefit. So we've gone through all the important things about these small notches on teeth that many people often ignore. Remember, these notches are not from brushing hard, but mainly from uneven bite forces and teeth grinding habits that are causing your teeth to bend and break gradually at the weakest neck area. If you ignore them, the consequences can be tooth sensitivity, pain, tooth decay, and even tooth fracture with very expensive treatment costs. But the good news is you can completely prevent and treat this problem by addressing the root cause through wearing a night guard, adjusting bite if needed, managing stress better, and filling current notches after controlling the factors that cause them. This is not a problem you have to face alone, and you don't need to wait until it becomes serious. Take action today by checking your teeth and scheduling with your dentist if you detect any signs. Your oral health is an important part of overall health, and taking proper care of it will help you live more confidently and comfortably in the years ahead. If you found this video helpful, please share it with your loved ones so they know to avoid these dangerous tooth notches. And please like my video so it gets recommended to more people. Subscribe to the channel so we can meet again in the next health tips. And please comment below to let me know if you've ever experienced this problem or if you have any questions about oral health. I'll try to answer them all. Thank you for watching and see you in the next video. Take care.